Imagine a pain that starts subtly, it grows over time. This pain can turn into a constant ache. It affects your ability to move freely. This is the reality for millions suffering from degenerative disc disease. DDD is a serious condition. It affects the spine, impacting every aspect of life. From simple tasks to enjoying hobbies, DDD can cast a shadow. DDD is a growing concern in our modern world. As our lifespans increase, so does the prevalence of age-related conditions like DDD. Our lifestyles often contribute to the problem. We spend hours sitting at desks, hunched over screens. This puts immense stress on our spines. The impact of DDD is not just physical. The chronic pain and limited mobility can lead to mental health challenges. Anxiety, depression, and social isolation can arise from the limitations imposed by DDD. The economic burden of this condition is also significant. Treatment costs, lost productivity, and disability benefits all contribute to the overall impact. To truly grasp the complexities of DDD, we need to start with the basics. The spine, our body's central support structure, is made up of bones called vertebrae. Between these vertebrae are the intervertebral discs. These discs act as shock absorbers, allowing for flexibility and movement. They are crucial for everyday activities like walking, bending, and even just standing. DDD occurs when these discs begin to degenerate, losing their flexibility and cushioning ability. This degeneration can happen due to aging, wear and tear, or injury. As the discs break down, they can put pressure on the spinal cord and nerves. This results in the pain, numbness, and weakness that are characteristic of DDD. Understanding the underlying mechanics of DDD is the first step towards effective management. Imagine the spine as a chain, each vertebra a link, strong and supportive. Intervertebral discs cushion these links, allowing smooth movement. These discs, likened to jelly donuts, have a unique structure. At the core lies the nucleus pulposus, a gel-like substance. This center provides shock absorption during movement. Surrounding it is the annulus fibrosus, a tough, fibrous ring. The annulus provides strength and flexibility, withstanding compression and torsion. Unfortunately, like any other part of the body, intervertebral discs are susceptible to wear and tear over time. As we age, the water content in the nucleus pulposus begins to decrease, making the disc less resilient and more prone to compression. This dehydration process is a natural part of aging, but certain factors can accelerate it, leading to premature degeneration. As the disc degenerates, the annulus fibrosus may weaken, developing small tears or cracks. These tears can compromise the disc's structural integrity, making it more susceptible to bulging or herniation. In some cases, the nucleus pulposus may even leak out through tears in the annulus, putting pressure on nearby nerves and causing pain, numbness, or weakness. While aging is a primary factor in disc degeneration, it's not the only culprit. Genetics plays a significant role, as some individuals are predisposed to disc problems due to inherited factors that affect collagen production or disc structure. Lifestyle choices also contribute significantly to the development of DDD. Occupations that involve heavy lifting, repetitive motions, or prolonged sitting can accelerate disc wear and tear. Obesity puts added stress on the spine, increasing the load on the intervertebral discs and speeding up degeneration. Smoking, with its detrimental effects on blood circulation, also hinders nutrient supply to the discs, impairing their ability to repair themselves. Understanding these risk factors is crucial for taking preventive measures and preserving spinal health. Degenerative disc disease, DDD, often begins subtly, a whisper of discomfort that can be ignored as a simple muscle strain. Early pain might be intermittent, appearing after activity or prolonged sitting. It manifests as a dull ache, stiffness, or tightness restricting movement. As it progresses, the whispers grow louder, demanding attention. Degenerative disc disease, or DDD, pain is not a one-size-fits-all experience. It can manifest in various ways depending on the location and severity of disc degeneration. For some, the pain remains localized to the affected area, a constant ache in the lower back or neck. For others, the pain radiates along the path of the compressed nerve. This radicular pain can be sharp, stabbing, or burning. The spine houses the spinal cord, a vital communication pathway between the brain and body. Numerous nerves carry signals to and from organs and muscles. A bulging or herniated disc can encroach upon these nerves, leading to sensory and motor disturbances. Numbness, tingling, and muscle weakness can occur, signaling nerve compression. These symptoms can impact daily tasks. Time, the relentless sculptor, leaves its mark on every part of our being, and the spine is no exception. As we age, the intervertebral discs undergo a gradual transformation. The nucleus pulposus loses water content, a process known as desiccation. This reduces the disc's flexibility and shock-absorbing capacity. Imagine a grape transforming into a raisin. That's akin to what happens to the nucleus pulposus with age. Lifestyle factors, you hold the key. While aging is an inevitable part of life, the rate and severity of disc degeneration are not entirely predetermined. Our lifestyle choices play a significant role in either preserving or accelerating this process. The way we move, the weight we carry, and even our habits can influence the health of our spines. Occupations that involve repetitive heavy lifting, prolonged sitting, or frequent bending and twisting can put excessive strain on the intervertebral discs, accelerating wear and tear. Obesity adds insult to injury, as the extra weight exerts constant pressure on the spine, particularly the lower back, increasing the risk of disc herniation and degeneration. Smoking, with its detrimental effects on blood circulation, deprives the discs of essential nutrients, hindering their ability to repair themselves. Genetics and other culprits. While lifestyle choices exert a powerful influence on spinal health, our genes also have a say in the matter. Some individuals are genetically predisposed to disc degeneration due to inherited variations in genes that code for collagen, the protein that provides strength and elasticity to the annulus fibrosus. These genetic variations can weaken the annulus, making it more susceptible to tears and cracks, even with minimal stress. Previous spinal injuries, such as fractures or ligament damage, can also increase the likelihood of developing DDD later in life. The initial trauma can disrupt the delicate balance of forces within the spine, making the discs more vulnerable to degeneration over time. The diagnostic journey. Diagnosing degenerative disc disease, or DDD, is like piecing together a puzzle. It involves a careful evaluation of the patient's medical history, a thorough physical examination, and often, the use of imaging techniques to visualize the spine's intricate structure. The journey begins with the patient's story, their experience of pain, and how it affects their daily life. The doctor listens attentively, asking questions to understand the nature of the pain, its location, duration, and any triggers that worsen or alleviate it. This detailed history provides valuable clues, pointing towards DDD as a possible cause. The doctor inquires about the patient's occupation, lifestyle, and any previous injuries or medical conditions, as these factors can contribute to disc degeneration. Unmasking the culprit. Physical examination. The physical examination is the next step in the diagnostic process. The doctor observes the patient's posture, range of motion, and any signs of muscle weakness or stiffness. Gentle palpation along the spine helps identify areas of tenderness, muscle spasms, or abnormalities in alignment. Specific movements, such as bending forward, backward, or side to side, are assessed to determine if they elicit pain or exacerbate existing symptoms. Neurological tests, evaluating reflexes, sensation, and muscle strength in the limbs, are crucial for detecting any nerve involvement, a common complication of DDD. Illuminating the shadows. Imaging techniques. While the patient's history and physical exam provide valuable information, imaging studies are often necessary to confirm the diagnosis of DDD and rule out other conditions that may present with similar symptoms. X-rays, a readily available and cost-effective imaging technique, can reveal bony abnormalities such as bone spurs, which can develop in response to disc degeneration. However, X-rays cannot visualize the discs themselves. For a detailed view of the intervertebral discs, their hydration levels, and any signs of herniation or degeneration, magnetic resonance imaging, or MRI, is the gold standard. MRI uses a strong magnetic field and radio waves to create detailed images of the spine's soft tissues, providing invaluable information for diagnosis and treatment planning. A multifaceted approach. Treating degenerative disc disease, or DDD, is not about finding a one-size-fits-all solution. It's about understanding the individual's unique needs and tailoring a treatment plan that addresses their specific symptoms and limitations. The good news is that for the vast majority of individuals with DDD, conservative non-surgical treatments provide significant relief and improve their quality of life. These conservative approaches aim to reduce pain, inflammation, and muscle spasms while improving flexibility, strength, and overall spinal health. The choice of treatment depends on the severity of the condition, the patient's overall health, and their individual preferences. In some cases, a combination of therapies might be recommended for optimal results. Conservative care, the first line of defense. The first line of defense in managing DDD often involves a combination of lifestyle modifications and physical therapy. Patients are, encouraged to maintain a healthy weight, as excess weight puts added stress on the spine, exacerbating pain and accelerating degeneration. Regular exercise focusing on strengthening core muscles that support the spine is crucial. Low-impact activities like walking, swimming, or cycling are encouraged, as they improve cardiovascular health without jarring the spine. Physical therapy plays a pivotal role in DDD management. A skilled physical therapist can design a personalized exercise program to improve flexibility, strength, and range of motion. These exercises often target the muscles surrounding the spine, providing support and stability to the affected area. While conservative treatments are successful in managing degenerative disc disease for most individuals, there are cases where surgery might be considered. If conservative measures fail to provide adequate pain relief, or if the patient experiences progressive neurological deficits, such as worsening weakness or numbness in the limbs, surgical intervention might be necessary. The decision to proceed with surgery is made after a thorough evaluation of the patient's condition, considering their overall health, the severity of their symptoms, and their response to previous treatments. Surgical options for degenerative disc disease vary depending on the location and extent of the damage. Discectomy, a procedure to remove a portion of a herniated disc that is pressing on a nerve, might be recommended. In cases where the disc is severely damaged or causing spinal instability, a spinal fusion might be necessary. This procedure involves fusing two or more vertebrae together using bone grafts and metal implants to stabilize the spine and alleviate pain. However, spinal fusion comes with its own set of risks and benefits, and the decision to proceed should be made in consultation with a qualified spine surgeon. Advancements in minimally invasive surgical techniques have revolutionized spine surgery, offering patients quicker recovery times and fewer complications. Minimally invasive procedures use smaller incisions and specialized instruments, minimizing tissue damage and promoting faster healing. Regardless of the surgical approach, the goal is to alleviate pain, improve function, and enhance the patient's quality of life. Understanding degenerative disc disease is a journey of empowerment. It's about recognizing that this condition, while common and potentially debilitating, doesn't have to define your life. Armed with knowledge about degenerative disc disease, its causes, symptoms, and treatment options, you can take control of your spinal health and live a full and active life. Early detection is key. Pay attention to your body's signals. Don't dismiss persistent back pain or stiffness as simply a part of getting older. Seek professional medical advice if you experience any of the symptoms we've discussed. Remember, you are not alone in this journey. Millions of people worldwide are living with degenerative disc disease, and many have found relief and improved their quality of life through proper management. The path to managing degenerative disc disease is paved with proactive choices. Embrace a healthy lifestyle, maintain a healthy weight, engage in regular exercise, and avoid smoking. These simple yet powerful steps can significantly reduce your risk of developing degenerative disc disease or slow its progression. If you are diagnosed with degenerative disc disease, work closely with your healthcare provider to develop a personalized treatment plan. Explore all your options, from physical therapy and medication to alternative therapies like acupuncture or massage. Surgery, while sometimes necessary, should be considered a last resort after exhausting all conservative treatment options. Your spine is the backbone of your body, supporting your every move. By prioritizing its health, you invest in your overall well-being.